The ICS Future Leaders Placement came from speaking to stakeholders, our placement providers, our HEIs, our social care providers, and asking them what they feel that students need in order to develop further and to grow ready for when they qualify.
The ICS placement really kind of came out of talking to students. Students were telling us that even though they were doing their degree, felt as though they didn't have the confidence, that they've not built that confidence through their course. So we thought, okay, from that, let's start to promote, and we found a lot of enthusiasm for this kind of placement.
What have I learned from this placement? Not just about the direct patient care, but also the broader structural elements that fit into that, including things like the research, the population health, the community focus that's needed, how that all knits together into an overall package of care for people as an individual, but as part of society, and that's been a real eye-opener.
Although the NHS has the goals and creates these values, how the ICS actually puts them into action, incorporating hospitals, social work and local councils, as well as other charities, to be able to tailor care for each patient so it's specific to them.
I think I've got a greater understanding of how things are working behind the scenes, so that we're able, as a body of different organisations and trusts, are working together to integrate the best possible care.
I feel the students have done really well. They started off this week being quite nervous and shy and reserved, but as the week's gone on, their confidence has visibly grown.
What was my favourite session of this week? I think for me it's going to come back to the session on public health. We spend a lot of our time thinking about the individual patients that we're dealing with. You can start to think, well, how can I then influence those broader issues? How can I make changes to how I interact with the individual patients I'm working with, but then also help the wider community that we're serving as well?
Encouraging the workplace was definitely top one for me, because it was really interactive. It was really nice being able to speak with all the other allied health professionals and seeing the impact that it can have in their role on a day-to-day.
It's been great to be a part of the wellbeing session. Our focus is the patient, our focus are those that we care for, but that we're also looking out for ourselves, we're also looking out for one another. We have to make sure that we're cared for and we're in a good place so we can then deliver the best care as well.
We initially had 10 students who had signed up, and quite quickly that moved to 15 or 20. But I think it just shows that there's an appetite for this kind of placement. Even though the HEIs do some really good work around preparing students for placement, I think we've really found our niche.
The first thing I would say to students considering this placement is to figure out why you want to come onto this placement. Is it that you feel that your leadership and communication skills could do with some improvement, or do you want to perhaps go into a leadership role once you qualify? If those two things fit the bill, then I would strongly recommend considering joining the ICS placement. And you can either do that by contacting your university or contacting me or Paul.
Would I recommend this week?
100%.
Most definitely.
This week has been amazing. I have learned so much from this week, and it has added so much to what I'm then able to bring into my practice as a student nurse, and hopefully then take on into the work that I do once I graduate. It's been absolutely brilliant, yes, totally recommend it.
If anyone wants a really well-rounded outlook on healthcare and the roles of the NHS, it's been really good. Understand on a deeper level the actual values and principles of the NHS.
This is something that should be integrated, I believe, into education. Everybody's got a part to play, and everybody's connected in that cog system that we've been learning about this week. Something that would be a real blessing to everybody within the healthcare environment.
The plan is to expand in capacity, maybe into 30 or 40 students, but also more importantly is increase the frequency of this placement. We are planning on developing an express day, which we would run weekly, and those would just be run-through workshops of the key sessions throughout the week.
We have already got a Gold Week planned, which is a slightly more advanced version of this placement. That's already subscribed. It's the student test, so do students actually want a placement like this? And I think we've answered that as a yes.